A good evening to all of you, our esteemed viewers. Yes, the day might have been long and some of you are still in jam, but you're trying to watch this particular program using your phone via YouTube, Family TV Uganda, and of course, credit to all of you who downloaded the Family TV app. I believe you're enjoying the app, but of course, you who are in your living rooms watching us right there, you're also great. We love you so much. This is Health Pot. This program brought to you by Makerere University School of Public Health together with Family TV. That is why it is on this station. And of course, this program is always on Friday at exactly 7 p.m. And we look at maternal health and early childhood development. Like we had Dr. Olive last Friday, she's back to take us through another session of what she did share with us. Dr. Olive Namuga is a researcher at Makerere University School of Public Health. So, Doctor, we are glad you're back even this Friday to teach our viewers.
Thank you, Edwin.
Kindly greet them.
Good evening, viewers. It's good to be back, and thank you for hosting me.
So, you who might have missed out last Friday, we started on a topic which is so sensitive, and this topic is about mothers who are HIV positive, because they also need to be mothers. If you're a woman and you're HIV positive, you also need to be a mother. And doctor assured us that chances are high that you will give birth to a child that is HIV negative, as long as you follow the guidelines. You can check out for these guidelines on YouTube. The program is that HealthPot. But just to give you a hint, she said, as long as you take your ARVs in time as prescribed, as long as you follow the precautions the doctors tell you, your child will be safe. But last week, she also told us that there is a group of children who, much as the mother has done this, sometimes test positive. She also told us, no, that's not the end of this baby. This baby will live. Just the health practitioners or the attendants will tell you what to do with this baby. Don't seek information from anybody. Just seek information from those people in facilities, health facilities. And not everyone you find there, a fellow patient or what. No, these should be health workers. Health workers. They will guide you on how to deal with this particular challenge. But today we want to look at this other group of children who we call them HIV exposed uninfected. They're exposed to HIV, but they're not infected. We want to talk about this group. Doctor,
Yes.
how does this group come about? They are exposed and not infected.
So thank you, Edwin, for that question. As our viewers may remember, we've talked about this baby from the time they are born.
Yes.
And the mother is HIV positive. As we follow up these children for the first 18 months, a few children seroconvert. And by seroconvert, we mean you do a test and the baby is HIV positive. So, but the good news is, with the current ARVs we have, this number is now very small. So majority of our babies are now HIV exposed, but they don't get HIV infected. So that's the group we are talking about today, where the mother has HIV, they've carried this baby, they've delivered this baby, they've breastfed the baby, so the baby all this time is exposed to HIV, but throughout this time they don't get the virus. So they are HIV exposed and infected.
Is it partly because of the mother did whatever they told them to do?
Exactly. It's because of all those steps that we've gone through, where the mothers have to take their ARVs. And we thank God that we have these ARVs in this country, and they are freely available. These ARVs are free and they are available at all government healthy facilities. So the mothers just have to go for their HIV tests, and if found positive, please remember that you can still have a negative child, and you will still be able to breastfeed your child safely.
So, while looking at this child, is she normal like any other child, much as she's exposed to HIV?
So, the technical, I don't know what you mean by normal, but
Okay.
actually, this baby is...
Can we compare this baby to a baby who is born of a mother who is negative?
So, if we compare these two infants, they are a little bit different, because this baby who is born to an HIV positive mother has had what we call exposures that this other infant, where the mother is HIV negative, has not had. One of that exposure is the HIV virus itself, because as the mother, during pregnancy, this mother is HIV positive during labor and delivery and during breastfeeding. So that is one of the exposure that they've had. And this exposure, in addition to this, they've been exposed to ARVs, which the mother is taking. So some of
through the breasts?
Also through the breast milk. So some of these exposures interfere with the infant's immune system. So some research has showed that these babies are a little bit different from the baby born to an HIV negative mother.
What is the difference? What is that difference?
So the difference is mainly in their immune system, that at the time when they are born, because of these exposures that they've had, exposure to HIV, exposure to the ARVs, exposures to some infections which are unique to this HIV positive mother, their immunity is a little bit, should I say, disorganized because of these exposures. They are more prone to getting the common childhood illnesses. Their risk of getting these illnesses is high.
What are these illnesses?
The common childhood illnesses like diarrhea, pneumonia, malaria. So these children are more prone to getting those infections.
Because the immunity was affected.
The immunity was affected. And even when they get these infections, they are more severe in these children. You may find that if they get a pneumonia, then the pneumonia is more severe compared to the other infant, where the mother is not HIV positive. So, but that is not the end of the world, because we know this. So there are things we do to support the mothers during this time to protect this infant. So much as they don't have HIV, they are more prone to getting severe infections. They are more prone to being hospitalized. They have a high morbidity and mortality, meaning they are more prone to these infections, and they also have a higher risk of death from these infections because they get the severe forms of these illnesses.
So you say that there is a way you guide mothers on how to deal with this.
Yes.
How do you?
So, like we mentioned last time, one of the ways is to through infant feeding, which we talked about in detail last time. We also talked about septrin prophylaxis for these infants. And we start the septrin, like we said, at 6 weeks of age. Then we also have routine vaccinations for infants. So as we are all aware, there are vaccinations that any child born in our setting is supposed to get. So for the HIV positive mother, we emphasize more that please do not miss these vaccinations, because they also boost the baby's immunity. So the other one is at the time when they stop, after the first 6 months, when they start complementary feeding, we emphasize nutrition for these infants to try and build their immunity. Yes.
So you talked about them, and now I want us to break them down.
Okay.
First, you talked about vaccination.
Yes.
Yeah. Or maybe before even we go to vaccination, let's start with the breast milk itself, because now a mother out there must be confused. Earlier we said that when they exclusively feed this baby, then it will help their immunity grow stronger. And then they have exclusively fed the baby, breastfed the baby, but then the baby turns up in such a situation. What brings that? What happens to the immunity? What happens to the nutrients in the breast milk?
Okay, so maybe so that the thing is when you're breastfeeding, there's what they call antibodies which you pass on to your baby. So that is one of the benefits of breastfeeding. Aside from nutrients that the baby gets from the breast milk, there's also what we call antibodies, which is basically for their cells for fighting infection. So, but because this mother is HIV positive, even them their immunity is a little bit low. So you don't expect her to pass on enough antibodies to this child. So that is why even when they're exclusively breastfeeding, the baby's immunity may continue to be low, much as the mother is passing on some antibodies. They may not be adequate enough, or they may not be compared to the other mother who is HIV negative. So you find that the baby's immunity continues to be low, but there's a catch-up time where these babies actually stabilize, but that time is being still researched about. When does their immunity stabilize? It's still being investigated.
And I believe when you finally come up with that time, we shall come back here and tell the people. Let us shortly go for a commercial break. We shall be right back shortly.
As you think about the Lord just taking over your case and you are no longer in the midst of it, and he says, fear not.
Demons from the mountains, scream and leave.
In the name of the
Demons from the graves, scream and leave in the name of Jesus.
Welcome back from the commercial break. The program you're watching is Health Port, the program that specifies in maternal health and early childhood development. This program is brought to you by Makerere University School of Public Health. We are with Dr. Olive Namuga. She's taking us through our children who are exposed but not infected with HIV/AIDS. Doctor, before we went for the commercial break, we were looking at breastfeeding. But breastfeeding, especially when it comes to mothers who are HIV positive, is associated with a lot of challenges. What are some of these challenges that you can talk about, some of the common challenges that you've registered?
So thank you, Edwin, for that question. And this is actually one of the challenges that these mothers face, because the guideline is that mothers, HIV positive mothers, should breastfeed their infants exclusively for the first 6 months. And by exclusively, like we explained, we mean they do not give anything,
Not even
water to this baby for the first 6 months. Now, in our setting, we have a lot of, I should say, culture, practices, beliefs around this infant. So you find that these beliefs and practices interfere with this guideline, and some mothers find it very challenging. So that is one of the challenges that mothers face. that relatives, friends will come giving all this information surrounding chogero.
When the mother in the village hears my daughter gave birth, they'll
Yes.
go into the bush and
bring chogero. Some of them are telling this mother, give some drops in the mouth. There's that time when some babies get colic. People have all kinds of therapies surrounding this condition. But I just want to remind our mothers, please, when you're HIV positive, you have to remember that we are trying to protect this baby from her or he getting HIV infected. So please, we encourage you to remember this and do not give any of these I don't know what even to call them, or remedies or whatever that the relatives may tell you to give this baby, because this increases the risk of you passing on the virus to this baby as they are breastfeeding. So the other challenge is, let's say, working mothers. Some mothers have to go back to work before 6 months.
following our like Uganda.
Yes.
Because a mother is given 3 months.
Yes.
And that is government and private. After 3 weeks, they need you back to work.
They need you back to work. Meanwhile, you have to exclusively breastfeed this baby. And please remember that this is not just a guideline, but breast milk is actually the best food for this baby. It has all these nutrients, antibodies that these other formula feeds do not have. So it's the best food for the child. So these mothers who are working or have any other condition that may interfere with exclusive breastfeeding, please come to the healthy workers and we see how to support you. And we see some mothers may have to express the breast milk and leave it behind for someone to give, but also ensure that the person who is taking care of this baby during that day while you are away is not giving additional feeds which are not breast milk. So it may require you to instruct this person if they are your close relative. Some mothers disclose to this relative that this is the situation and I have to exclusively breastfeed. So don't just leave your baby with someone who has no idea what you have to do. They will end up giving things that they are not supposed to give to this
Some
baby.
leave them to maids. And then these maids don't even know what to do. They're not even trained. They're not, they just, and then they just
Yes, so you can actually explain to the maid that please don't give anything other than the breast milk that I've left. And you as a mother, maybe you can know that my baby takes this much and ensure that you leave enough milk. Because if the milk is over and the baby is crying and you're still at work, that's when they are tempted to give these other feeds, which we don't want the baby to get, because they will increase the risk of you infecting this child. But because the situation varies from mother to mother, we advise our mothers that if you're finding exclusive breastfeeding a challenge, please come to the healthy workers and we support you and we look for ways of how you can do this given your situation.
Is there a special way you can help them?
I should say at the moment I've heard of a breast milk bank, which is I think in Zambia Hospital, but it's not really my area. But that is one of the ways that in some countries, also in our country here, there's what they call breast milk donors. But I don't want to go into that area. Yes, but I know that in this country, I think there's a breast milk bank where, and this it's a new area where, let's say, HIV negative mothers who have babies but have extra milk. They express this extra milk and take it to the breast milk bank. Then this milk can be given to other babies. So this other mother is a donor. So she donates this breast milk.
The way we donate blood.
Yes, and this milk is given to, so that would be a very good alternative for this baby. But in our country, it's really still in infancy
And it may
stages.
be so expensive.
Yes,
So,
so those who are interested, they can look into it. At least I know it's, I think, in Zambia Hospital. Yes, there's a breast milk bank, but I don't know how it works because that's not my area, but I know it's there.
Okay, then you also talked about nutrition. Now, the mother has breastfed this child exclusively for 6 months. Then, what about after the 6 months?
So
Let us talk about the nutrition after 6 months.
yes, thank you, Edwin. So after 6 months, the child starts what we call complementary feeding. This means in addition to the breast milk, the mother can give these additional feeds. But also this, we don't want it to be done haphazardly. So we prefer that mothers come and they're educated on infant feeding. And most of the government facilities we have in this country, they have what is called a nutrition unit, which is usually attached to the EID clinic. So this nutrition clinic or unit has sessions. Usually these clinics are not daily clinics. They have maybe specific days when they run these clinics. But in the facilities where I've been, these clinics are actually there and they are very functional. So they have sessions with these mothers where they educate them on how to prepare food for these infants, how to prepare a balanced diet, how to prepare the foods themselves. So, and they have practical sessions where they get the food, they get a charcoal stove, and they actually cook and demonstrate for the mothers. So this is why we always encourage our mothers, please don't shun healthy facilities. Please go to your nearby healthy facility. There's all these other things that you learn.
There's a lot of information.
There's a lot of information. There's a lot of support that you may receive, especially if you're HIV positive. Yes. So mothers can actually be health educated on how to feed an infant because they're not going to be fed like you because you're an adult. So the food has to be balanced, but also the cooking methods. Some people don't know how to cook this food, how to prepare vegetables.
When you talk about people not knowing how to cook, someone may think that you're talking about someone not knowing how to spice their food. Yeah.
Not really.
So that it can produce that aroma.
Not really. That's not what we are talking about. We are just talking about the methods for preparing a nutritious meal. So, for example, if you're going to give vegetables to an infant, how would you prepare them so that you maintain all the nutrients and you don't destroy them by heating? So this is usually through sessions, practical sessions that are conducted at these facilities. And they are not daily, but they are actually there. Those services are there. So I encourage mothers to, when you go for EID, please ask for the nutrition unit, because we as healthy workers are willing to refer you there. Please come when you have time to listen. Come when you have time to attend the demonstrations, because it's actually very beneficial for the baby.
Okay.
Yes.
And then let us talk about vaccination, because these were the three aspects you talked about.
Yes.
Yeah, vaccination. And what about this vaccination? Why is it that you ever emphasize that mothers who have these babies should make sure they don't miss out on vaccinating their children?
So this goes to all mothers actually. These vaccines help to boost the infant's immunity. So we have what we call routine vaccinations, and most mothers know these are given at birth. There are some vaccinations given at birth, vaccinations given at 1.5 months, 2.5 months, 3 months, and then at 9 months for measles and some additional booster doses. So as we may all know, these vaccines actually boost the infant's immunity and increase the protection that this baby has against the common childhood illnesses.
Okay.
Yes.
So, yes, much as this may not be part of the childhood, but now that the exercise of vaccination is on, please, if you're among the group that is supposed to be vaccinated, go and be vaccinated. Remember, COVID is real. Doctor, thank you so much.
Thank you for hosting me.
We are glad and we are grateful. Yeah, a credit goes back to Makerere University School of Public Health. They have come up to erase all the lies, all the false information that you have, that you've gathered from wherever you've gathered it. And all we want to equip you with is true and right information which has been researched. That is why people come here, specialists come here, and they teach us, they educate us. We are so grateful. Thank you so much for always following, for always watching Family TV and Health Port. Very many programs are still coming. You shouldn't miss them. Edwin Osteen Mukalazi is my name. We need you alive. God bless you. Good night.